Okay, so I'm going to go through the day two training here. Again, just like day one, we have some certain tasks that we want to get through. On day one, we concentrated on the front office. Day two, we're going to concentrate on hygiene and the interaction between hygienists and doctors. If you're in an office without a hygienist, all of these same things apply. You're simply going to be acting as both the hygienist and the doctor. So I'd like to start off quickly with kind of an overview of what we're going to go over, and then we'll start getting into it. So you'll go ahead and read the hygiene manual. The hygiene manual, or the hygienist is also in charge of all of the OSHA type things. So the lead hygienist will be in charge of making sure that your entire staff has their CPR certifications, making sure that all of the OSHA stuff is up to snuff for all of your staff members. So huge resource there. The effort for all of this stuff for the hygienist is usually a few hours a year, so it's not super extensive, but it's nice to have another provider to share some of the managerial and administrative burdens there. And then you're going to shadow the hygienists and the doctors during their exams, obviously paying particular attention to the flow of how a periodic exam works and how a comprehensive oral works, okay? And then you're going to look at the charting sequence and reading the diagnosis to the hygienist. We'll also understand hygiene utilization. What is hygiene utilization? Hygiene utilization is one of the main metrics that we use, which is if every appointment is considered to be an hour, and let's say that the hygienist works 10 hours, how many appointments did they see divided by how many hours did they clock? So a lot of times you'll hear a hygienist say, hey, we are a super busy office. Well, when you go in and look at her hygiene utilization, she's only being utilized for 8 out of the 10 hours, meaning really we should really try to have the hygiene utilized 100% of the time. The hygienist used 100% of the time. Hygienists are super expensive, and so it is very tough to make money when a hygienist is being utilized, honestly, less than 75% of their day. You're only making money on the hygienist if they have a utilization over 75%. We're going to go over scheduling recall, which is super important, scheduling under slow and busy schedules, and kind of the verbiage on what you should or what you and the hygienist should say when rescheduling patients. Okay. We're going to learn treatment planning, sequencing, insurance planning, insurance retreatment planning, meaning what happens when an insurance patient who had Delta and you have an extensive treatment plan under the Delta fees comes in and the following year they have Cigna. How are you going to retreatment plan? We'll talk about bundling fillings, meaning essentially if you have an occlusal and a buccal and you do them on the same day, you cannot charge out as two fillings. It needs to be an occlusal buccal. And the Colorado Medicaid rules, super important to know. Again, this is very similar to professional athletes in that if they are going to go into their game, they need to know all of the rules. And we're playing the dental game. We need to know all of the rules so that we can help our patients basically complete the procedures more easily and more cost effectively because we know the rules. We're going to learn how to make deals. Basically, we're going to help patients be more astute as far as what their benefits cover and sequencing those procedures so we can utilize their insurance money more than their out of pocket. Okay. So we'll learn to what we call play the insurance game, which is basically helping our patients utilize their insurance money the most efficiently. And then we'll also learn how to recognize when the insurance is not entered into EagleSoft correctly, which is super important. If you don't understand when the insurance is incorrectly, you're going to be doing a lot of free dental work because you will tell the patients, hey, you owe $5, when in reality, they owe $500. So it's super important to recognize that. I'm going to start off by doing a quick Eaglesoft overview here. Okay, so this is the main screen that you will see when you log into Eaglesoft, and this is called patient management screen here, or practice management screen. So a lot of times, and this is actually a bunch of links, so you can actually click on this link and it'll highlight clinical, and you can go here and it'll go to the clinical screen. And then you can go back here and it'll go back to the practice management screen. Our main scheduling screen is called On Schedule. So you can click on Schedule and then you can go back to practice management, okay? Another shortcut is by pressing the F9 key, or in my case, function F9, and it'll take you back to practice management. So if you come in and you can highlight some of these particular areas. One area that's super important is the time clock. So your staff can clock in and out, and you will be clocking in and out for the first few months of your practice, since you will be paid an hourly wage. So super important to understand this screen and On Schedule. Okay. The first thing that you're going to want to do is have your owner doctor set up you as an Eaglesoft user and provider. So when you click on this, it's going to have a list and you're going to click on new. Okay. Now this portion is super important right up here. You need to put in your 3 initials. Okay. This shows up on the clinical ledger later on, and this is your one and only chance to get this right. Now, sometimes people don't have a middle name, and so you might set up something like this instead, okay? It is important to have the 3 initials because there is a lot of collisions in names if everyone sets it up with just 2 initials. So if you can set it up with 3 initials, that helps, okay? So you're going to fill in all of this information here, okay? It's important to put your address, city, your phone number. If you have an assistant out or an emergency contact situation, it is nice to be able to have their number here, okay? You need their birth date. This is not only for here, but also for providers, we need our birth date on there because there's a certain amount of this information that is going to go on the claim. The hire date is super important for the staff because there are some benefits that happen once they have been at your office for more than a year. So making sure the hire date, social security number is important. The position, obviously we're going to put dentist for ourselves. Now this is important also. Collections for us usually will go to the owner doctor, or excuse me, the collections will go to you, but the provider on the insurance will always be the owner doctor. Until you become the owner doctor, the owner doctor will be on the insurance forms, okay? We will use the master standard fee, and then it will be your email, your personal email here. And obviously this address is your personal address, okay? You will be using the time clock, and obviously you're going to be active. The color, not as important here, okay? And then up here, it will be important to put in your identification. Now, a lot of this information is going to be provided to you. For example, the billing entity, and the bank account number. Super important to fill out this bank account number. In the future, if you see when you print up your day sheets, Eaglesoft is built so that it can handle 2 bank accounts, meaning maybe there's 2 people, 2 doctors working, and they each have their separate practices within the same building. Eaglesoft can print up day sheets so that the money goes to each account. For us, we only use 1 bank account. So if you make sure that this bank account matches what the owner doctor has, there'll only be 1 day sheet that's printed up. Okay. A lot of times we get questions about why is there 2 day sheets being printed? That's the reason why. Okay. So the federal tax ID that comes from the practice, your dental license number. Now from Colorado dental license numbers, they are officially DEN dot and then a big long number. In here, you only need to put the number in. Okay. So it'll be something like that. Okay. Your NPI goes here, your DEA number. Now, if you don't have your DEA yet, that's fine. Just leave that blank. If you don't have your Medicaid number, that's also fine. Okay. So again, that's that sub window. You'll just go ahead and close that. And then you're going to make up a password here. So you'll make up your password. A lot of times here, we're going to just fill in these questions like this because you rarely are going to forget your password that you're going to use every single day. So once you're done with that, you will save this and you will go in there and assign hours. This isn't going to let me do this right now. And then also any of your CPR type stuff will go into your employee smart doc or electronic repository, so that is never missing. So that's just an overview of Eaglesoft there, okay? I'm going to go into on schedule here and I'm going to go into a quick overview on how to get to the clinical things, okay? So it's super easy with Eaglesoft. If you click off of a patient and you click on any of these buttons up here, and by the way, at the very beginning, you might want to have all of the text underneath there. So you can click on here and show text on schedule toolbar. So sometimes you're going to see Eaglesoft set up like this, and you're like, what are all these buttons? If you simply just come here and click here, you're going to see the text of the buttons, which will make it easier. Okay, so if I click off of this particular patient and then I click on their chart, it's going to ask me to which patient I want. Okay, if I click on this patient and then I click edit patient, it's going to go directly to that patient. I'm just going to remove this alert real quick. So that's the same thing with everything here. Okay, so I can come in here and I can go to their note history, or I can click off here and then it'll make me select the patient. Okay, so a lot of times I'm seeing people, and if you double click on the appointment, it also has those same buttons here. So you're going to get really good at what these buttons are for, and so you can get them through the appointment, but it's best to simply just click on the patient and then click the appropriate item. Okay, so we're going to go through the odontogram first, or the chart. So you access it through here, okay, and you can see the odontogram here, okay. A couple of different shortcuts here is when you come in and you want to look at their x-rays, you're tempted to go to this digital x-ray, but this digital x-ray is to create a new x-ray. What you really want to do is click on images here, okay, and it will open up the patient images, okay, and then you could just click here and you'll see the different x-rays that have been taken, okay. The other shortcut that you are going to use quite a bit is the perio chart. So if you click on the perio chart, you will see the perio chart coming up here, okay. Now, you'll see a bunch of buttons over here on the right. These are essentially the diagnoses codes. So I call this the main button, and then underneath the main button are specific codes, okay. So on some of them, for example, this surgical extraction, if I click on surgical extraction, it's going to say, oh, do you want an surgical extraction or is it an existing surgical extraction? So I can click on proposed, and that would be we're extracting number 16. But what if we decided that that's going to be a simple extraction? S extraction means surgical extraction. If we wanted a simple extraction, we would just click on the down triangle and then click on the 7140 code and go from there. Okay. So Eaglesoft is also going to use the last proposed or existing. So if the last code that you use was proposed, the next one it's going to also do proposed. Okay. So you can select multiple teeth and, for example, do a resin composite here, and it will apply that to both of the teeth, as you see there. Then it's going to show up. I actually had 16 selected. It's going to show up down here in the ledger, okay? And it's going to be the same color as up on the odontogram. So I'm going to go ahead and delete those from the ledger. You can delete them down here, or you can delete them up here, okay? I like to work off of the chart a lot just because I know that I'm not mixing things up. But you'll kind of get your preferred way of getting into the specific services there, okay? One important thing with Eaglesoft is, let's talk about exploding codes. So exploding codes are a group of codes that are batched together, okay? And we have our list of exploding codes right here. And these are pretty much standard across all of the open and affordable offices, okay? So you have the new patient limited exam, which is a D0140 and a D0330, basically a limited and a pano. We have a new patient to hygiene, which is the 4 bite wings, the prophy, and the comprehensive oral. So I want you to get into the habit of using exploding codes. Why? Because they're a group of codes that need to be walked out at certain procedures, okay? So you know, at the new patient to hygiene, you're usually walking out the new patient to hygiene exploding code. When you have a new patient adult with prophy, you're going to be walking out the new patient adult with prophy exploding code. So super important to know those exploding codes, and that's how you access those, okay? So once we go into the chart again, okay, we are going to see, you know, obviously all of the teeth. You can choose if a tooth is missing by clicking on this missing tooth button, okay? And I'll show you kind of the standard way of how we chart things, okay? So if you look at this situation up here, then this is out of your assistant manual. I've tried to explain all of the different permutations of what things can be charted as, okay? So number 2 is a proposed, or this tooth needs to be extracted, okay? So red is proposed, and it's what needs to be done, okay? Blue is existing and what was done at another office. So if you look at number 3, that has an existing occlusal, let's say it's an amalgam, okay? But look at the difference between 6 and 1. What is the difference there? There an extraction that was done at a different office versus a missing tooth. The difference is that this patient walked into your office and you took the pano and you noticed that number 6 was present, number 1 was missing, and then 2 years later you came in and you noticed that 6 was missing. Well, guess what? 6 was extracted at another office. So there's a different designation between missing tooth and extracted tooth. The nice thing about Eaglesoft is when you click on missing tooth or also impacted tooth, it's going to take it off of the perio chart, so you don't have to skip over those, okay? The other thing too is, so number 4 is a green, which is completed, and that's what we did at this office. Purple is what is in the walkout queue, so what will be charged out today. So you'll see that purple, okay? Orange is referred out. So this patient, we referred out a root canal on number 31, okay? Yellow is a watch, okay? The way that you're going to access watches is this way. So you're going to be on a particular tooth, you're going to right click and you're going to click on add watch, and that's how it turns yellow, okay? And we might say we're watching the occlusion, okay? And then when you click off of there, you see that it's yellow, okay? So gray circle is this impacted tooth. So number 32 is impacted. How do we access some of those conditions? So let's say that 32 was impacted. We'll click on that and we'll just click on the impacted button here, and it will put that over there, okay? And then we can also delete things exactly like we look at particular procedures, okay? And then we talked about the gray being the missing tooth and the blue X is the existing extraction, okay? Now, number 16, you can see is something going on there. What that is an upper denture. Now, I like to click on only one tooth when I plan a denture or a partial instead of clicking on all of the teeth that they are having replaced, because if not, this denture will cover up the existing teeth, and I won't be able to see what I have planned underneath there. Okay, so we can look at that very quickly, and we can see what that would look like if I decided to propose a denture here, and I said I want it on the entire upper arch. You're going to see that it just covers everything. So there's no way for us to see what's going on. So instead, we're going to select just a single tooth so that we know that we need a denture, but their existing teeth are up there. Okay. Some other EagleSoft type training here. We can access the perio chart from here. Okay. And you can see that it has removed the teeth that are both missing and impacted. Okay, so when we look at here, it's automatically it's going to chart the gingival margins. Okay, and you can see that this is the way that we chart, and it's always the same at Open and Affordable. As we start on tooth 2, and this is on the buccal, and then we'll go to the lingual, and then we'll go to 32, go on the buccal, and go through the lingual. So, and then you simply just type in the numbers. So if we were doing 323, 323, 323, 323, and then we would just chart their entire dentition there. Okay. You can also chart bleeding points, and you can also chart periodontal depths. I think I might have had this backwards, that the gingival margin would be charting recession, and the periodontal depths is what you initially chart. So let's just see how this works. If I click here and click on gingival margin. Okay, so yes, the periodontal depths is charted up there, and the gingival margin is charted here. Okay, so usually we're charting the gingival margin there. Okay, so that's how you're going to perio chart. You will click on save, and then if you want to go compare depths, pocket depths, you can chart those and compare them from past exams. Okay, they do have some more fancier charts back here, but that's essentially how you're going to go in and perio chart. So one of the first things that you're going to do with the hygienist is they're going to request you to help them perio chart. Now these automatically feed automatically. So as soon as you're at the end of 15 buccal, it's going to go to 15 lingual. Once you're done with 2, it's going to go to 31 buccal. Okay. Okay. So that's kind of some EagleSoft basics here. Now we're going to get into the specifics of our comp oral and our periodic exam. Okay. So again, I've listed some of these items, and this is coming out of the assistant manual. So PD is the pocket depths, and GM is the gingival margin. Okay, and you can, if you need to, you can, if you mess up, you can simply just go back to the particular spot with your mouse and overwrite it. Okay. And then sometimes, obviously, if you're not going to be charting this one, you can just press 0 and it'll bypass that particular tooth. You usually want your hygienist to have charted as much as possible before you walk into the room on your periodic and your comp orals, especially the existings, so that you don't have to be repeating them. And a lot of times you're going to go in there and look at those together with the hygienist before you walk into the room. Which brings me to my next point. So, huge importance to use your hygienist as another provider. Usually the flow is going to be this. With a new patient, there's really 2 appointment types, okay? So with EagleSoft, there's appointment types. So if we take a look at this and we go to on schedule and appointment types, these are the appointment types, okay? So because there can be different provider types in your office, such as a general practitioner, a hygienist, oral surgeon, we've designated those here at the very beginning. Then there is the procedure type, okay? And then there is the operatory that it usually is going to be scheduled in, okay? And then the colors. Mostly don't change these because these are mostly controlled by corporate or your owner doctors, and we don't want to be adding appointment types just because you think that there should be an appointment type. These appointment types have been vetted out over several thousands of appointments. So if you look at our appointment types, we have crown bridge preparation, crown bridge seat. Now, why do we have these appointment types? They're all based on what the assistant will be setting up for you. So it's important that we are as accurate as possible when scheduling to get the correct appointment type. Okay. So we have delivery of a lab case, could be for a night guard. Denture, secondary impression, super important because a custom tray needs to be made for that appointment. And so that's different than just a lab case. Or a denture's no lab case. With a lab case, we need to be making sure that we have that lab case there. With the no lab case, obviously we don't, okay? GP emergency for a new patient versus a recall patient. Usually we're going to use different exploding codes, and we're going to be sending out different new patient text messages depending on if it's a new patient versus a recall patient. Extraction multiple, single, fillings. Here's our implant restoration, okay? Our implant surgery. We have root canal. We have an unspecified appointment used very infrequently. This might be a pathology follow-up. We have a Zoom whitening, and then we have our hygiene appointments. Super important to understand these. New patient to hygiene is a patient who has come in for an emergency. We've taken care of their chief of complaint, and now they're coming back to get their first cleaning visit after their emergency. So we would expect that this patient already has their pano taken and already has their insurance verified. They're simply coming in for their cleaning and their comp oral. This appointment type, new patient with prophy adult, is a patient who's coming in for the first time to the practice, just wants a cleaning, and is coming in with the hygienist, okay? This is a new patient with prophy child, same kind of a situation, but for a child. Perio maintenance, hygiene prophy adult. This is your recall appointment, okay? This is your recall baby appointment. This is your recall child appointment. Here's your SRP. We also track excused absences and no-shows. We'll have a different video about those. And then here's your oral surgery type, your oral surgery extractions. Guess what? These are oral surgeons accomplishing these procedures, not general practitioners. So if you're doing an extraction as a general practitioner, you'll be using these two. If it's an oral surgeon, they might be using these codes or appointment types here. Okay. So a little bit of EagleSoft training there. Okay. So back to our training mechanism here. When you're with the hygienist, you want to meet with the hygienist outside of the operatory before you go in to see the patient. Why? Because they're going to tell you they have just spent an hour with the patient taking x-rays, cleaning their teeth, and they're going to be able to tell you a lot of things that are going on in their mouth. I super encourage my hygienists to know as much or more than the doctors. They're the ones that are in there for an hour. You're going to be in there for 5 minutes. So if they see a filling that's needed on the buccal of 27, great. I love to hear about that. Or they can talk about periodontal status. They can even talk about behavior type issues. So again, have that open communication with the hygienist. So you're going to meet with hygienist outside briefly. They're going to see what's going on and tell you what's going on. And then you might even look at x-rays together outside of the operatory. And then you will go in and introduce yourself to the patient. Now, I'm going to make a separate video on your introduction to the patient, which is going to be super important. But let's skip that in this particular video. I'll have a separate one for that. So you're going to go in and introduce yourself to the patient. And then let's say that this is a comprehensive oral, what we'll tell the patient is, so what we're going to do is we're going to look at your x-rays, and then we'll take a look in your mouth, see if there's anything that's going on, come up with a game plan together as far as what we both want to do, and then figure out what you want to do and when, okay? Those exact words are in the office manual, okay? Or on the doctor manual. So memorize those words because it's really something that you don't want to miss, okay? So we're going to take a look at your x-rays, then we'll take a look in your mouth. we'll come up with a game plan together as far as what we both want to do, and then we'll figure out the prices of that game plan, and then we'll figure out what you want to do and when. Okay, so you'll go ahead and review the panoramic x-ray with the patient, and then you'll review the bite wings with the patient. And there are some offices that alternate and they'll take the pano and the bite wings on the first comprehensive visit, and then they on their next periodic visit they will take the PAs for the anteriors. Some offices simply just take the pano and the bite wings, and then they're going to take bite wings once a year. So ask your owner doctor what your office usually does. Okay. So you'll review those with the patient, and I like to have my computer screen at the patient 8 o'clock. So if you imagine the patient head is at 12 o'clock, their toe is at the 6 o'clock, I like to have a big monitor at the 8 o'clock so that the patient can simply look over at the x-rays with you. Some offices aren't configured that way. Sometimes the screen is behind the patient. If that's the case, sometimes what I'll do is I'll have the patient stand up and I'll have them look at the x-rays with me so that they can understand what is going on with their mouth. I like patients to be able to see everything that I'm seeing. That's why I like huge monitors. I like mirrors. I don't want to overemphasize it, so I'm not using a ton of intraoral cameras to show them a stain on the distal buccal of 31 so that I can show them that they need a filling back there. I would rather them see it in a mirror just because it's the same size as what I'm seeing it as. And if they can see it, they have more confidence in me that I'm not trying to upsell dentistry. I'm not trying to make things up. I want to show them what I'm seeing. So super important to review those x-rays with them. So afterwards, if this is a comp oral exam, I'm going to start with comp oral or not, I'm going to start with the external or extraoral exam. You do not have to do an extraoral exam if it's an emergency appointment. You're really just dealing with their chief complaint. But this is a comp oral or a periodic, so I'm going to do an extraoral exam. Some doctors like to look at the thyroid or feel the thyroid. Some doctors just prefer to look at the submandibular nodes. And then I usually I'll go to the TMJ, check for any clicking, and then I will look at their soft tissue, and then I will have them stick their tongue out to the front, and I will fold a 2x2 gauze, grab their tongue, and pull it to each side, take a look underneath their tongue, and then I'll take a final look at their entire oral cavity soft tissue, see if there's any pathology. Once I'm done with that, I will say these exact words to the patient, which are very important. So I'm going to be reading off a lot of stuff to the hygienist. If you need anything, I will tell you, okay? It's super important to say those words because if not, the patient psychology is going to, or their self-esteem is going to go down and down and down as you read off all of this stuff that they either have or need in their mouth. So it's super important to preface your exam with those words. And in reality, this is called the talk-over technique, meaning you're talking to the hygienist, but really you're kind of talking to the patient, and they're listening and making judgments on everything that you're saying. So again, those words are, so I'm going to be reading off a lot of stuff to the hygienist. If you need anything, I will tell you, okay? So then we need to make sure that our exam is thorough, consistent, and easy for the hygienist to understand, okay? So I want you to do this on every single patient and make it super consistent. And this is a very important selling point to the patient. If you do not do a thorough exam, they will not trust you. They are paying you a lot of money so that they can know that their dentition is healthy. So making sure that you look at every single surface of every single tooth is super important. I always look at it this way. There are 6 surfaces to every single tooth. And it is important that you look at every single surface. So, for example, in your panoramic x ray, you're looking at the first surface, which is the apex of every single root. In the bite wings, you're now looking at 2 more surfaces. You're looking at the distal and the mesial, okay? And then our clinical exam is there to look at the buccal, occlusal, and lingual. So make sure, obviously there's more surfaces that you're looking at clinically, but you need to make sure that you're considering all 6 surfaces, okay? So my clinical exam would includes the things that the patient has and the things that the patient needs. So, for example, in this case, for this particular patient, I would say, so hygienist, patient has missing number 1. Now, if you think about psychologically what the patient is hearing, they're like, what? I have a missing tooth? I didn't know that. So whenever I say this, I'm going to say, so number 1 is missing. That is your wisdom tooth. Now the patient is like, oh yeah, I remember getting my wisdom tooth out. Number 2 needs an extraction. Now, usually in a situation like this, you've already shown the patient that they have a broken down tooth in the mouth. They probably know about it, but you pointed it out at the panoramic x-ray and you're like, yep, remember we talked about that number 2, that tooth on your upper right that needs to come out. And the patient's like, yep, I totally understand that. Number 3 has an occlusal. Let's say that this is an amalgam. So you'll say 3 has an occlusal amalgam. Now the patient's like, oh yeah, I have a filling there. Not a big deal. A lot of times because Eaglesoft has this proposed or existing, I hear a lot of doctors say, number 3 has an existing amalgam. Kind of repetitive there. You can simply just say 3 has an occlusal amalgam, okay? Number 4 needs an occlusal composite, okay? So on this portion, what I would do is I would take out a mirror and say, all right, patient, this is the first time that we're looking at this particular tooth. We didn't see anything on the x-ray. I wanted to show you this little brown spot right on the biting surface. Are you seeing that? Yes. Okay, yeah. So make sure also when I see this a lot, you'll show the patient in the mirror, but you leave the patient glasses on and they can't see anything through the dark glasses. So make sure you flip their glasses up for them, hold the mirror, and then have them take a look at that first cavity filling that they need. Okay. So number 4, in this instance, let's say that they needed a cavity filling on number 4. So number 4 is going to need an occlusal composite. So your hygienist or assistant is going to chart that, okay? Now, let me tell you just one consideration here. With Eaglesoft, it is very important that you chart posterior composites with this button and you chart anterior composites with this button. I wish that Eaglesoft was smarter and you could select both of these and just say, hey, I want a filling here, and it would code it differently. But unfortunately, if you look at this, there's a different code between an anterior versus a posterior. And if you send out a claim with an anterior filling queued up on posterior tooth, the insurance company will deny that claim. So again, it's important to understand anterior versus posterior. Okay. So let's go back to our training module here. Okay. So number 5, patient, remember we looked on the x-ray and there was a broken down tooth. We're going to get that crown on there. So 5 needs a crown. Okay. And then, so now we've read off, 4 teeth to this patient. He's like, man, I've got something or need something on every single tooth. So when you get to teeth that are good, let's say that we're at 7, you need to make sure that you say, so 7 is looking good, 8 is looking good, 9 is looking good. Now, psychologically, that patient is like, wow, I've got a good tooth. I've got another good tooth. I've got another good tooth. So really emphasize the positive with the patient that, hey, they have a lot of good teeth, okay? So, so 10 is missing, 11 is missing, 12 is missing, 13 is missing, 14 through 16 are missing. And then we talked about getting, let's say that this is a partial. We talked to patient about maybe getting that upper partial. 17 through 23 are missing. 24 is looking good. Number 25 is looking good. Number 26 is looking good. Number 27 is looking good. I don't really like to skip those numbers and just say, yep, other teeth are looking good. Why? Because I want to reemphasize the positive nature of good teeth and get that patient's self-esteem going in the right direction. So, and then I'll say, so tooth S is present. How do we chart primary teeth? Okay, so if we're here, we would simply select the tooth, and then we'll come here and click on primary. Okay, now you can click on one tooth and click on primary, or you can select multiple teeth and click on primary. So that's how you do that in Unisoft. This 30 is in the walkout, but let's say that we need an occlusal on 30. So number 31, remember we had looked at that particular tooth. We needed a root canal on that tooth because it's going through a crown and you're 85 years old and I don't see any canals. I've decided that we need to refer that tooth out to the endodontist, okay? So another thing here, we talked about those exploding codes. Let's say that 31 needed that root canal and we would need a crown on that tooth. Again, we're going to come in under the root canal buildup and crown exploding code, which is down here, and I'm going to click on that, and then we'll wait for this to queue up here in just a second. And then it's going to say, I want the crown, yes, okay. I want the buildup, yes. And I want the root canal, yes, okay. Now, with Eaglesoft, it is smart enough. It's not like the composites where you can click, you do not have to choose a molar root canal or an anterior root canal. It is smart enough to know that 31 needs a molar root canal, as you can see here, okay? So, and then you can see the odontogram changing ultra red. So, that's kind of our basics on this. Now, let's say tooth number 32 is our wisdom tooth. It is very important to chart wisdom teeth correctly. I see this quite a bit in that instead of marking a wisdom tooth as impacted, the doctor will chart it as missing. That's completely wrong. Again, you need to be super thorough about that. But the big thing is that you need to consider the wisdom tooth extraction status of every patient. And I'll just say that here in this video is the normal narrative or verbiage that I use around wisdom teeth that need to be extracted and what is our parameters with wisdom teeth that need to be extracted. I would consider anyone under 21 who has any type of wisdom teeth, unless it's crazy impacted or already around the nerve, to have those wisdom teeth extracted. It's just going to be so much better for them later on in life when they don't have those wisdom teeth. The other thing I would say is if someone is above 21 years old, actually I would say 25 years old, and the tooth is covered in bone, they might be okay without getting that wisdom tooth out, especially if you have situations around the inferior alveolar nerve. So above 25 and you see roots formed around the IAN and it's covered by bone, that tooth is probably going to be there for the rest of their life, and it's going to be okay because bacteria is not going to slide down the back of the second molar, okay? I would also say that adults that are past 60 years old probably don't need to get wisdom teeth out because they're kind of getting to, if it's a virgin tooth and they've been able to keep pretty good care of it, they might not need to get that wisdom tooth out. I'm going to make a separate video on those exact parameters, But let's say that it's just a normal adult with a wisdom tooth that needs to come out. Here's my verbiage to them. So, Frank, you have these wisdom teeth, and I know that you've kind of kept them in your adult life, but I just want to tell you that we ought to think about getting them out. First of all, is unfortunately, you're never going to be as young as you are today. Second of all, as you age, your bone around those wisdom teeth get harder. The other thing is that our hands stop working as well as they used to. So I would hate for you to get into your 40s and 50s and your hands aren't working as well as they used to. And we start getting a cavity in between the second molar, which is the tooth that you want to keep, and this wisdom tooth simply because you didn't get it out. And Frank, just taking a look at your dentition, you have a history of cavities on the back teeth. Even with your hands working as well as they do, you still had some history of getting cavities on there. The worst thing that I would want, Frank, is for you to go into your nursing home later on in life and now your hands really don't work and you aren't able to take care of that wisdom tooth and we get a cavity on it and we have to extract it and we don't know if we're on a blood thinner and the bone is a lot brittler. And now instead of getting it out while you're young, we have to get you into a life threatening procedure. And so, obviously, this isn't something that we have to do today, but if you can think about getting those teeth out, it would be super good for you. I also say this too. I mean, I take out wisdom teeth out of 70-year-olds all the time, and it's not fun for them, and it's not fun for me. So think about it. We do have an oral surgeon that comes in. If you would like to be sedated, that can be accomplished. And then you'll kind of talk about the oral surgeon if it's something that you're wanting to refer to the oral surgeon, or you'll talk about your own extraction methods, which is, hey, I'm going to have you completely numb. There's going to be wiggling. There's going to be pressure. We can do all four at once, or we can do one at a time, whatever you prefer. With the oral surgeon, he does offer sedation. So if you want to be put to sleep and wake up and you don't have it, there's still going to be a couple days of recovery. So you might need a couple of days off. But again, emphasizing the importance of getting those wisdom teeth out is to me being a true friend to your patient. I always talk about being a false friend and being a true friend. If your brother, sister, mother, father came in and they had a situation like this of a wisdom tooth that they've been told that they'll be fine with, and then your mother or father gets into a nursing home and they need to get that wisdom tooth extracted, you would have wished that their dentist would have been a true friend to them in their 20s, their late teens and their 20s, instead of, oh, yeah, you'll be fine. And then now your mom and dad is in a life threatening procedure in their 80s. So again, go through the narratives in the doctor manual and make sure that you have those narratives dialed in so that your comprehensive oral is very thorough and explains to the patient what they need. So as soon as I'm done with that, what I'll do is I'll usually review with the hygienist to make sure that we have all of the treatment, make sure that they haven't missed anything. And then what I'll do is I'll sit the patient up and say, okay, Frank, so you've got a lot of good teeth in there. I'm going to emphasize the positive. So we just have a couple of things that are going on. We talked about getting that tooth out, and I'm going to kind of talk to him in the order of what our plans are. Because the hygienist, some of your very experienced hygienists are going to actually phase the treatment depending on what you're saying to the patient right now, okay? Some of your less experienced hygienists, or if you don't have a hygienist, you're going to be treatment phasing them yourself, okay? So, for example, all right, Frank, so we have that one tooth that needs to come out. I know that we needed a deep cleaning. I would prefer that tooth to come out so that I can clean up under the final configuration. The last thing that I want to do is try to clean up on the distal of 3 when I've got 2 in the way that needs to come out. So we'll get that number 2 out first, and then we're probably talking about that cavity filling on number 30. and number 4 that we had talked about. And then we'll probably do the crown. Now we can maybe do the crown all at the same time. And then, it would be nice if, we don't have to get the wisdom tooth out. We can make that upper partial right now. And then once we're done with that, I saw that there was that little lesion on number 31. We'll have you go in and talk with the endodontist after we're done with all of our portion. By the way, Frank, what are your thoughts on that wisdom tooth? Let Frank talk and say, yep, I definitely want that 32 out. Sounds good. So let's go ahead and get that 32 out. And then after that, we'll get you to the root canal specialist. And you're just kind of talking with the patients, kind of figuring out what they want to do. And then you basically say, did you have any questions, Frank, on what we talked about? Okay. Now, on a situation like number 5, if it's a super broken down tooth, it's appropriate to talk with them about a crown or an extraction and the different prices. So it's going to be important for you to kind of have memorized what certain procedures cost. And you're going to be talking about finances with the patient. And we're going to talk about that on the second day video, or this training module on how to play the insurance game. But a big portion of that is knowing prices. And so you can make a clinical judgment with the prices, the financial constraints. So Frank, so we got this broken down tooth at number 5. So 2 options. We can put a crown on it. You're looking about $800 minus whatever your insurance picks up, or you're looking about $300 minus what your insurance picks up on an extraction. If we do an extraction, we want to do an implant later on. You're looking about $3,500 soup to nuts minus what your insurance picks up. So if you can save it with the crown, you're going to be a lot better off financially. Oh yeah, let's go ahead and do the crown. So by the end of your treatment plan, you shouldn't get up and say, oh, by the way, so here's a bunch of things that you didn't understand, and this is a surprise to you. No, by the time you get done with this and you're doing your little summary, the patient's like, oh yeah, we talked about that extraction. Yep, I decided I want to do the crown on 5. We don't want to do the implant. Yep, I talked about the partial that I wanted. Yep, I saw the cavity filling that I needed on 4. Yep, I want that cavity filling on 30. Yep, I saw that lesion on the apex on the panoramic x-ray. Yep, I know I need to go out to the root canal specialist to get that one. And yep, I agreed that I want to get that extraction done. So again, by the time that you sit them up, you will not have any surprises when you're going over the summary. So then after the summary, then you're going to go to the treatment plan, and we will phase it, and then we will print up the prices, and we will discuss with the patient the prices, okay? And I'm going to put that as part 2 of this video. So that's part 1 of our video, and we'll continue on part 2.